We're back again, John, part 2 on respiratory. What are we going to talk about now?
Well, today, Kirstles, we're going to talk about surgical conditions of the respiratory tract, and then move on to some facts about equine asthma.
Super.
So, surgical conditions of the equine respiratory tract are basically conditions that need surgical intervention in order to cure them, and they mostly revolve around problems with the horse getting air into the larynx. This is the larynx, which is a sort of Lego model of cartilage that is at the top of the trachea, and it acts as the gateway to the horse's lungs. It controls the amount and the speed at which air can enter the lungs, which of course has an impact on how much oxygen gets into the bloodstream, and therefore how well the horse can continue to work without fatiguing. Kirsty, you have extensive experience in respiratory surgery in your previous incarnation.
Yeah, look, I worked obviously in a referral hospital on the Curragh. We would have done a lot of wind surgeries. We would have seen a lot of wind surgeries, mostly in thoroughbreds, to be fair, so your race horses. But we would have seen some sport horses with laryngeal paralysis, which I know we're going to talk about. But yeah, not something that was uncommon anyway. And just the varying degrees was really fascinating to see, like, how bad they can get and how you can rectify and fix problems. It was amazing.
Yeah. So, as Kirsty says, the big respiratory condition that's cured by surgery is called laryngeal paralysis, or RLN, which is recurrent laryngeal neuropathy. And if we look at what the normal larynx looks at, this is an endoscope, which is a camera at the back of the pharynx, at the back of the throat, looking down into the larynx, and that's the windpipe going down between these two cartilages. These two cartilages are hinged at the top. They're called the arytenoid cartilages. And every time the horse inhales, these cartilages swing open in order to allow the air in. And
it's a really clever mechanism as well, John, isn't it, around swallowing? And how the epiglottis flips up to allow then food to go down into the esophagus. So it creates that seal, and obviously if we have any issues within the anatomy of it, that seal can be altered, and if we're doing surgeries then as well, we can alter that seal. Isn't that right?
Yeah, absolutely. The horse is unusual among domestic animals in that it can only breathe through the nose. The horse can't actually breathe through the mouth. The horse's soft palate should always lie below the larynx here, and when the horse swallows, these cartilages close so that food can't tumble down into the windpipe. So these cartilages, it would make sense, maybe you would think, just to have no barriers there to air going in, but because the horse food has to go past here, and the esophagus is actually just up here. This is where the esophagus, we can't see it, but if you're actually scoping a horse's stomach, this is you're pointing the scope up here. But the cartilages have this protective effect, so we do have to have them able to open and close to control air going in and to stop food coming out. The main condition that we're dealing with problems of the larynx, which affect the respiration, is left-sided collapse, and it's an extremely interesting condition because it's always the left side. You would think that perhaps it could be, either side, just depending on what side's affected, but it's always the left side. And even though in the body most things are perfectly symmetrical, in the horse's larynx, the nerve that controls the muscle which makes this cartilage works on the left side travels all the way down to the horse's chest and all the way back up again. It really makes no sense. It's an anatomical disaster area, and the length of this laryngeal nerve seems to make it non-functional. So this left-sided arytenoid cartilage becomes paralyzed in these horses, and it just drops. And as that cartilage drops in, as the horse breathes in at fast work, it creates a huge suction. And it actually, not only does this cartilage lie here sort of blocking the airway, it actually gets sucked across like a vacuum cleaner sucking your curtains across. It actually blocks off the airway. And we've got some video now of an endoscope on a horse on a treadmill, and if you look carefully if we're looking at the video on this left-hand side, you will see this arytenoid cartilage being sucked in. So you can see here the horse is galloping, the scope is in place, and you can see this left one bouncing across, totally blocking the airway.
And this was done on a treadmill, John, was it? Or?
Yeah, this is done probably on a treadmill or on the gallops with the scope being sent to a camera on the rider's head. But you can see that every time that this arytenoid cartilage will get sucked across, there's virtually no air that can pass into that horse's larynx. So that horse, 3-mile steeplechase in heavy ground, it's just going to get no air. It's like somebody shot it from the stands. It's going to go straight to the back of the field. So this is the condition that is there are various degrees of it, but in the worst case, where like this, the horse will literally not be able to breathe at fast work. And the surgery to correct this, and I use terrible bunny ears to say correct, because there really is no complete correction of the surgery, but the most common surgery that Kirsty will have assisted with on hundreds of occasions probably is called the Hobday. And horse people, we all talk about that horse had to be Hobdayed, or that horse had Hobday surgery. You don't really know what it is, but it's actually named after the guy who developed this surgery 140 years ago, and he was called Sir Frederick Hobday, who was veterinary surgeon to Queen Victoria. And he was quite a clever guy because he worked out what was going on and he invented a surgery to correct it. And Kirsty, you've experience of it, and you would say that this surgery it can be quite effective in these horses.
Yeah, it's probably one of the more common ones that we would have done. Now, the traditional way we did it would have been knocking them down, you know, and through an incision. There's other ways of doing it with lasers and doing it standing. You know, a Hobday will be done, you know, I don't know the exact percentage, but we done more commonly than, say, the more extensive tie-back surgery, where you're actually tying up that arytenoid out of the way. So yeah, lots of horses have had it done, and I suppose the main thing is, and especially we have this huge movement of ex-race horses coming out of training and going into more like sedate riding homes, or they may be then going on to be performance horses, maybe they're eventers or whatever. A lot of those horses may have had a wind surgery done, and I suppose that's something that we'd like to try and educate people on, is the different types of wind surgeries and how then to manage those types of horses to make sure that they're not running into trouble with, you know, respiratory issues and things like that. So yeah, lots of horses that have had Hobdays done in racing. Yeah.
The Hobday surgery basically involves going in and creating a little bit of scar tissue so that the arytenoid sticks back. But as Kirsty says, there is more extensive surgery for the worst horses, where that arytenoid is then anchored completely back, and that then can cause side effects of food tending to go down the trachea. These horses can cough. And again, if you rehome a horse out of a racing yard that's had a tie back, you need to know that, and know that the horse is going to do that fairly normally. So if we move on to the second topic, which is equine asthma. Equine asthma is just, as it says, it used to be called various things. It was called OCD, it was called COPD, it was called respiratory obstructive disease, or obstructive respiratory disease. Now we call it equine asthma. And what it is, it's horses that have an allergy to dust, primarily from being stabled, and those microscopic particles of dust travel down to the very small airways in the lower reaches of the horse's lungs and cause an allergic reaction, stimulating the horse to constrict its airways, so it's got a much narrower space for the air to pass through, and there's mucus production there. So that makes the horse have a rattly chest, where it's difficult to get air right down into the lower reaches of the lung, and that causes breathing difficulties when the horse has an acute outbreak of equine asthma. The typical symptom that you'll see is cough, sometimes a nasal discharge, and in the worst cases, what you can have is as in this horse, you can have the development over a longer period of time of this muscle line here in the thorax and abdomen, and this is called a Heaves line. And this is so called because these horses that are severely affected by asthma find it so difficult to breathe that the muscles that make their chest work, like bodybuilders, these muscles have to work so hard that they become extremely enlarged. And a horse like this that has had a Heaves line has had equine asthma for a long period of time. Kirsty, this would be very common in all classes of horses, probably even more so in pleasure horses that are stabled a lot. Yeah,
equine asthma has become really kind of quite prevalent because the way we're managing horses now, and you know, the intensive housing environments in some cases, you know, so there's a huge environmental factor to this, John, and what we're trying to do is, you know, look at how we're keeping horses, how we're minimizing dust, how we're trying to use our bedding that's, you know, dust extracted or not terribly dusty straw, things like that, and then, you know, our forages and making sure that our forages are clean and good quality. And if we have a situation where our forage is maybe subpar on hygiene, if you like, it's how then do we improve that. So we're looking at things like steaming, soaking, as far as being able to improve the quality and the hygiene quality of hay. Steaming is far superior to soaking. 100%. So, you know, and that's, you know, treating the hay at high temperatures. So, you know, you're getting your molds, your yeast, your aspergillus, you're killing down the dust, you're actually making it quite palatable as well. We have the steamer working away here this week, and people are walking past and you can smell it even. It's, you know, it really does make the hay, you know, smell and taste extremely good to the horse. Having your stabling, you know, well ventilated and things like that, that's really important as well. And lots of turnout. Turnout's great. Dr. Green, get them out, get their head down. You know, it's really good for them. It's good for their head, and it's great for their lungs.
Yeah, absolutely. And as Kirsty says, it's all about, there's no cure. It's probably got a genetic basis in these horses with asthma, because, you know, horse A will have it, horse B won't have it. So it can be brought on by respiratory tract infections, which seem to make the lungs more sensitive, and that sort of can sort itself out over time. But some of these horses, it's a lifelong problem. So soaking hay, as Kirsty says, is essential. It'll dampen down that dust. You know, we soak the hay for sort of 12 hours, so your morning hay gets soaked overnight. But a much better way to do it is the steamer, and we've got one going here at the show, and it steams the hay. So not only does the steam dampen, soften, and completely take away all the dust, it also kills, by virtue of high temperature, the fungal spores and molds that could get down into the lower reaches of the lungs and stimulate the horse's immune system to attack them even more, which will cause more inflammation. So horse steamers are affordable, and they're the gold standard, as Kirsty says, way to go. Ventilation, very often horses' stables can be quite traditional, and that's part of, sometimes, you know, part of their beauty. But really, with any livestock housing, there's a simple principle, is that the livestock in the building creates heat from its metabolism. That heat rises, warm air rises. So warm air needs somewhere to get out. So all stables should have a vent at the top. The warm air comes out, and that creates a draw, like in your chimney at home, and it sucks fresh air in at the side. So there should be outlets at the side. So with horses with a stable cough, making sure that your stable ventilation works, and this is the basis of it, is also going to be important. Nebulizers, Kirsty, you've a lot more experience in this than me, but this is obviously very similar to people's asthma inhalers, and it's pretty much the same principle. Yeah,
so the nebulizer works through vapor. So you've got a chamber on the top here, you've got a little battery powered unit on the side, and then through a little gold disc it vaporizes the liquid. So within the chamber you can have medications, you can have various respiratory treatments, you know. A lot of people will say, can I put like essential oils in there? Absolutely not, you can't. They're very corrosive on the horse's respiratory system. So always make sure you're using something that is approved to be used in the likes of the Flexi Neb here. And what it does, it only takes 5-10 minutes depending on how much you've got in the chamber. The horses tolerate them really well. And something as simple as saline through that, just to dampen down the airway, is, you know, a really good thing. Obviously if there's medication going in, you have to be careful around withdrawals and things like that for competition and racing, but not some, like you'll go down into the international barn here at the RDS and you will see several of these down with the international horses, because they're travelling a lot, they're on lorries for long periods of time, maybe they're flying, they're in recycled air, and that does affect their lungs. So yeah, nebulizer's really popular now, John.
And I think one of the benefits, and Kirsty touched on it there, was that drugs will then be absorbed into the circulation, which could have an effect. But with nebulizers, very little of the drug will end up anywhere other than the lungs. So the horse's bloodstream, it couldn't have a performance-enhancing effect if you're using drugs like steroids. So they, like the best medicines, they act where they're needed and nowhere else. So they're a very good way of giving these horses the drugs they need. The alternative is to give the horse steroid anti-inflammatory drugs in the worst cases where these horses are in real respiratory distress. There's a horse I treat at home, and every winter it is 2 or 3 attacks where it gets into real respiratory difficulty, and it needs some intravenous steroids every day for 2 or 3 days. Then it goes along all right for a while until it gets out to the grass, and then there's no problem until the following year. So administering systemic steroids, in other words steroids into the bloodstream, are often needed in these horses, and can be, if not life-saving, certainly very essential for the welfare of the horse. So that's a quick canter through surgical conditions and asthma. So thank you very much, Kristen.
Thanks very much, Sean.
Thanks now.